Hello and welcome to our webinar hosted by eSight and Dr. L. Penny Rosenblum, who is the Director of Research at the American Foundation for the Blind. So we are putting on this webinar in light of World Sight Day, which is an annual day of awareness held on the second Thursday of October each year. This Awareness Day was created to focus global attention on blindness and visual impairments, and this year's theme is Call to Action. So joining us today, we have Brian McCollum. He is the Chief Commercial Officer of eSight Eyewear. So during his presentation, he's going to talk about some interesting statistics and solutions here with eSight. We also have Gary Foster. He's a longtime wearer of eSight, and he lives with macular degeneration. So he's going to share and shed some light on his story. And we also have Dr. L. Penny Rosenblum. She's the Director of Research at the American Foundation for the Blind, and she's going to share some unique statistics and insights from recently. So I will go ahead and start the webinar by turning it over to Brian from eSight.
Thanks, Lauren. I would like to start by setting the framework for why we are here today. Over 2.2 billion people globally live with a vision impairment, with about 1 billion of those having a condition that could be or could have been addressed. A lot of the news we will see on World Sight Day will be related to those unaddressed global issues, but we want to take a few minutes and focus on the 32 million Americans, or about 13% of the US adult population, who have difficulty seeing even with prescription glasses or lens. More specifically, we would like to speak to the 7 million plus Americans that live with serious eye conditions and the more than 500,000 children who live with visual impairments. If these individuals whom eSight seeks to serve, we have created a life-changing technology that offers hope to many of these Americans as well as other nationalities living with similar conditions. This year, World Sight Day is focused on the hope in sight. As these stats suggest, hope in sight is a critical conversation and there is much work to be done. For the next few minutes, I would like to discuss how we at eSight see new possibilities to create that hope through technology. eSight was founded on the very principle of helping the world see new possibilities. Our technology empowers individuals living with low vision impairments to achieve their goals, and in turn opens the eyes of everyone to the abilities of this community, and that creates a better, more inclusive world. It is our belief that innovation only yields true advancement when the discussion switches from what we can do for this population to what this population can do for the world with just the right tools and opportunities. We are striving to disrupt the healthcare industry and how it views the benefits of the most advanced vision augmenting platform today. A platform that goes beyond just impacting someone's quality of life, but allows that individual to be both mentally and physically healthier. eSight really is in a class of its own in its pursuit of not just enabling the low vision community to see clearly, but to enjoy life fully. We have made significant investments in both proprietary hardware and software that was designed with a singular aim of creating a tool that can help low vision individuals do whatever in life they set out to accomplish. eSight moves seamlessly with the wearer throughout their day while providing the best visual acuity, unmatched mobility, and a greater ease of use. Let's talk a little bit about how it works. eSight is a head-mounted device that uses a cutting-edge camera, smart algorithms, and high-resolution screens to provide the brain with increased visual information that compensates for gaps in the user's field of view. It functions by stimulating synaptic activity from the remaining photoreceptor function of the user's eyes. The device captures high-quality video and displays it on two high-resolution OLED screens directly in front of each eye. The use of custom optics and proprietary algorithms enhances the image and results in maximizing sight function. eSight is proven to be most effective in correcting acuities of 20/60 up to 20/800, and in some cases effective up to 20/1400, with many of our wearers achieving 20/20. We have a diverse age group of wearers and find at least 15 degrees field of view is necessary to see the best results. eSight is used daily by patients with over 20 different eye conditions, including macular degeneration, Stargardt's disease, diabetic retinopathy, and retinitis pigmentosa. The eSight platform has been validated through a multi-center, prospective, peer-reviewed published clinical trial that was conducted across 6 leading independent low vision research institutes and spanned an age group from 13 to 75. The key endpoint findings resulted in a 7-line gain in distance acuity, a 12-letter contrast improvement, 100% mobility retention, and significant improvements in facial recognition. In developing the new eSight 4, we had the benefit of having over 25,000 individuals with low vision who had tried eSight at one point over the past few years. The feedback was overwhelming in a few key areas that we have incorporated into our latest generation device. Visual acuity followed by mobility. Yes, absolutely. They want to see better, but they also want to see while doing normal life activities like cooking, commuting to work, or enjoying the outdoors. In order to be truly mobile, they need a device that is comfortable only over longer periods of time and one that has an extended battery life, which we accomplish with our Halo design and interchangeable battery concept. We have been able to accomplish these critical features while making it incredibly easy to use. Throughout the iterative design, development, and testing cycles, we did in-depth ongoing research with over 100 low vision individuals that allowed us to better design both the hardware and software platforms that met the user group's expectations. The result is an eSight 4. eSight 4 builds upon the best of eSight 3. It uses the same clinically validated technological approach. It continues to integrate the wearer's natural peripheral vision for maximum mobility, and it maintains our patented bioptic tilt so that the wearer can have maximum vision that includes both enhanced vision and peripheral vision that results in a more natural vision experience for the wearer. It also continues to allow for necessary acuity features like adjusting for pupillary distances and distances to and from the eyes. We have the privilege of meeting and helping exceptional people on a daily basis, and today there are thousands of people who use eSight daily to achieve their goals. eSight is helping individuals with serious visual impairments advance at school, continue in their work, get back to work, advance in their career, or do activities of daily life that fully sighted people take for granted. Before I turn it over to my fellow presenters, I just want to leave you with a personal note. I could not be more excited to be part of the team that is leading eSight into the next chapter of our journey that continues to improve our technology while making it more accessible to the people that can truly benefit from it. Before we hear from Dr. Rosenblum at the AFB, I would like to introduce you to a longtime eSight wearer who will be sharing his personal story about living with macular degeneration. Gary, the floor is yours.
Well, hello everybody, and it sure is great to be included in this. I have been wearing eSight since 2013, and I can tell you that when I first lost my ability to do the things that I was used to doing, it was pretty tough on me. I was a very active person. I was a pilot. I did a lot of cross-country driving and loved that it was my thing to do. I loved to work outside. I loved working with my hands. And I wasn't able to do all of the things that I was used to being able to do. And I struggled trying to find ways to fill my day. And it got to the point where I didn't notice it so much, but my family was telling me that I seemed to be a little depressed. I wasn't very social. I didn't want to go places and meet people and talk to people, because without being able to see people's faces, I found it awkward having a conversation. I didn't get the feedback that I was used to getting, and I just from the visual clues, and it just made me withdraw. And I was really upset about not being able to work anymore, because I'm a bit of a workaholic, and I really struggled. And my doctor just kept telling me, "I'm sorry, there's just nothing that can be done. This is common in my family. My mother went blind, my grandmother, two of my uncles. And since I've been through my journey, my sister, who's a year younger than me, she's now going through vision loss as we speak. As a matter of fact, she can no longer drive." But I was at a seminar one day, and with my wife and my sister, and after being blind for a few years, and they saw this device out at a table, and they insisted that I go and look at this device, and it sounded too good to be true. And I went out and I looked through these glasses and I didn't say a word. And my wife said, well, what do you see? And I said, I can see your face. And she started to cry. And I looked around the room and I said, I can see everybody's face. I couldn't believe it. And then the fellow that was holding the glasses up, there was a long line of us waiting to see through the glasses. He just said next, and it was somebody else's turn. And I walked away with more questions, and I just couldn't believe it. I wanted to know just how much these glasses could really do for me. And I was living in Calgary, Alberta, and I flew to Toronto, Ontario, and went to the eSight offices and went through a demonstration. And I was not prepared for what this could do for me. And I can tell you that in the last few years, I'm doing everything I ever did before, except I can't drive a car, and I don't think anybody would get in a plane if I was the pilot, but I do everything else. I read all the time. I can watch television. I'm very social now. And more important, it's always been a lifelong passion working with wood. And I have a full wood shop, which I thought I would never be able to enter again. And now I'm building things all the time. And just to give you an idea, I'm 2,400 without eSight. And with eSight, and I think this is very telling, I can thread a needle with ease. And if I didn't have eSight, if I was holding a needle up in front of me, I wouldn't see it at all. So you can imagine, I mean, it's very effective. It's incredible for me. It takes me to 2020. And I can only say that for me personally, everywhere I go, people ask me what I'm wearing. And I'm happy to say, this is eSight. This is what it's done for me. I encourage people, if they have members of their family that can use this technology, I tell them how to get a hold of eSight. I want everyone that can use this device, I want them to be able to have the opportunity to discover it just as I did. And I can only say, life is great, and thank goodness for eSight. And now I'd like to turn this over to Dr. L. Penny Rosenblum.
Great. Well, thank you so much, Gary. Hearing your story just was so valuable for me. As a person with low vision myself, I am thinking I need to try an eSight very soon. But my focus today is actually a little bit different in that I want to talk about a study that we're involved with here at the American Foundation for the Blind that has to do with COVID-19. So I'd like to reflect a little bit on the challenges that people with vision loss across the United States and Canada have had due to COVID-19, and also share some thoughts with the media. So let me tell you briefly about the American Foundation for the Blind. We are getting ready to celebrate our centennial in 2021, and there aren't too many organizations that can say that. One of our main focuses is to expand and share knowledge, and so I'm very proud to be the director of research. We also advocate for policies that will benefit those with vision loss. So I'm actually housed in our Public Policy and Research Institute. The leading journal in the field of visual impairment is called the Journal of Visual Impairment and Blindness. AFB works closely with SAGE, which is the publisher, to make this journal available. And we also have a consulting arm at AFB where we work with companies to make sure that their products, their websites, their apps are accessible. And we do other things as well, but these are a few of the highlights I wanted to share. Now, like many of you, my world turned upside down in March when COVID-19 really became front and center here in the United States and across the world, over the course of the beginning of 2020. AFB was one of 16 organizations that collaborated together to launch a survey called Flatten Inaccessibility. And you can go to our website, afb.org/Flatten Inaccessibility, and read the report. I want to point out to the media that this report is fully accessible, whether you look at it online or if you download the PDF. This report, it can be used by somebody who is totally blind using screen reader software. So you might want to look for some of the alt tags and other features that we have added to make this report usable. But anyway, that's aside. The report focuses on the experiences of 1,921 adults with visual impairments in the United States. And we found that two of the areas of greatest concern for these individuals are healthcare and transportation. So I want you to stop for a second. And I want you to think, especially back to March and April. Did you have it planned out where you would drive to for a COVID-19 test if you needed one? Did you have it planned out how you would get your groceries, whether that was driving to a store and doing curbside pickup? Was that using an app to have groceries delivered to you? Was that going to that store with your mask on just as quick as you could and running down the aisle, scanning very quickly on the shelves to find the 5 or 6 items that you needed and getting out there just as quick as you could? Those things, those daily living things that are part of all of our lives, became very challenging for people with visual impairments. And that has to do with some of the things I'm going to talk to you about here in just a second. But hold on to those thoughts for me. We also have just completed the Access and Engagement report, and this examined how education was impacted by COVID-19, both in the United States and Canada. We had 20 collaborating organizations. We had family members who shared information about 455 children. We had 1,028 professionals. These are teachers of children with visual impairments and orientation ability specialists. And hot off the press, we have just posted the executive summary at afb.org/access engagement. We anticipate that the full report, again in accessible format, will be available by the end of October. AFB has also launched a workplace technology study where we want to understand what are the technology experiences people who are visually impaired have in the workforce. What training do they get? What tools do they get? What tasks do they have to do? What are the barriers? And what do they wish for so that their workplaces were more accessible? We want to better understand the mainstream technology they use. So their iPhones, their laptops that quote unquote anybody can use, but also the assistive technology they use, like screen reader software, a program called JAWS, or a program called VoiceOver that's built into every iOS device, including your iPhone. So we want to understand more about how we can support people with visual impairments to be successful in the workplace. All right, so COVID-19 turned our world upside down, as we all know. And for those of us with visual impairment, for those of us who support people with visual impairment, COVID-19 has really drawn attention to what I call systemic issues. These were issues that were here long before that little virus started floating around the world. Accessibility of apps, websites, and telehealth, access to equitable and affordable transportation. These are not new issues because of COVID-19, but they have been exacerbated because of COVID-19. We're also, though, facing new issues that drive up test site, those online shopping apps. How do I social distance when I can't see the person who's 6 feet away? Let's visit on some of these topics real quickly. So when I think about accessibility of apps, websites, and telehealth, I think about the tools that I use, whether it's the app, whether it's the website. Is it laid out logically? And this would include for my screen reader software to read to me. Are the buttons and images labeled? Because a lot of times they're not labeled. So I'm hearing image, button. Well, what does it do? What does it mean? Sometimes part of the tool will be accessible. So I might be able to get on and connect with my healthcare provider, but the tool to message my healthcare provider is not accessible to me within the app. Sometimes there are poor color combinations. So as a person with low vision, drives me nuts. A lot of times buttons on a website might have a very thin gray line under them or not even have anything, but you're supposed to magically know that this is a button, and I can't find that. And things like we're using Zoom right now to record this session for you. Parts of Zoom are very accessible, but there are some features in Zoom, such as polling, which is not accessible. So how is I, as a presenter or a participant, going to participate if the facilitator wants to use polling, and rightfully should be able to? Access to equitable and affordable transportation. What we've seen is because people are staying home more, because people are concerned about social distancing, that many locales have limited or canceled routes. If my way of getting around with my visual impairment is public transit and those routes are no longer available to me, how do I get to the grocery store? How do I get to the doctor? How do I get to my job because I am an essential worker? So we also have had a long time issue with needing to schedule your paratransit rides ahead of time. So there's a little vans that you see in many communities for people who have disabilities or are elderly. If I now am not feeling well and I need to get somewhere quickly, if paratransit will even take me because I'm sick, I have to schedule it sometimes 3 days in advance. How do I know when I'm going to be sick or when I'm going to run out of milk? With people being laid off and furloughed, for a lot of folks, transportation is not affordable. And this is a real concern. If I don't have a way to get to the things I need to do, how am I going to make it happen? And then unique to COVID, many communities, to protect the driver of the bus, are now requiring that you board through the back door. Couple problems here. One, if you're an older person or a person with a physical disability, stepping up those big steps on the back of the bus is not easy. Sometimes it's impossible. Two, if I want to confirm with the driver that, yes, this is the number 9 bus going east, I can now not talk to the driver. Another challenge with public transportation is being able to judge who's around me. Am I 6 feet from somebody? Are people wearing masks? I can't take in that information easily, if at all, and so that becomes problematic. Let's talk a little bit about that drive-up test site or that online shopping. How in the world do you get to a drive-through or drive-up test site when you don't drive? You're not going to ask your neighbor. You're not going to ask your friend. You're not going to ask the Lyft or Uber driver for a ride if you have symptoms of COVID. You're putting somebody else at risk. They may very well not at all want to take you. So how do you deal with that? You need a COVID test. You need to go to the pharmacy or restaurant to go through the drive-through. In our Flatten Inaccessibility report, one of the participants over 75 years of age talked about, I called the pharmacy to say, hey, I'm blind, can you deliver this medication? And they said, oh no, you have to come to the drive-through window. And she said, well, exactly what car do you think I'm going to drive? Food banks. We've seen long lines of cars for food banks. How do you get to a food bank and wait in that line if you have a visual impairment and don't drive? Stores and curbside pickup, another issue again. You know, it's great that so many places have contactless pickup, but if I don't have a way to get there. And then delivery services with limited or no slots. We had people in our study who talked about if they could get the app to be accessible, or they could figure out the workarounds for the app that wasn't accessible, then they were faced with there were no delivery slots for the next 1, 2, or 3 weeks. A person in our study talked about that she was able to get food no problem through delivery, but none of the local stores would deliver diapers. You had to go in person to get diapers. She's like, I have children. How do I do that and keep my children safe, let alone the transportation? Social distancing. Now, I don't know about you, but I go to the store and I see red stickers and blue stickers and X's and O's telling me where to stand and showing me exactly how many, 6 feet distances from somebody else. If I can't see those markings on the floor, how do I maintain social distancing? If I'm used to going grocery shopping, and when I get to the store, I go to the customer service counter and I ask for an employee to assist me with shopping, or I go shopping with my neighbor on Thursday, or I hire somebody to take me shopping. And now with social distancing, I'm not able to get the assistance that we need, that I need. I'm really in a quandary, because what had been working for me very effectively in the past, COVID-19 has put a damper on. And like many of us, people with visual impairments are experiencing feelings of isolation. And this is not unique to those with visual impairment, but it is exacerbated more for many people with disabilities because of that inability to maybe just get out and go for a little drive by yourself in isolation in your own car isn't available to those of us with visual impairments. And for many people with visual impairments, they have additional disabilities. Just under half of our participants reported that they had at least one additional disability. So having that compromised health really impacts who I can be around, and having to make some really hard decisions. So these are just a few of the beginning findings from our access and engagement and our flattening and accessibility reports. I am really a strong advocate of how the media reports on and portrays people with visual impairments. Actually, a colleague and I years ago wrote an article, actually we wrote 2 articles about young adult literature and how characters with visual impairments are portrayed. So if you want to run my name, you can find that article. But I really believe firmly that as media personnel, you need to think carefully about the stories, whether they're blogs, whether they're podcasts, whether they're newspaper pieces, whether they're live interviews. It's really important that you focus on the problem or the solution and not the superhuman person. I cringe when I read, blind golfer makes hole in one. It should be, man from such community stuns everybody with a hole on one. And that should be in the second paragraph before I find out he's blind. But as media personnel, obviously you need your hook. But please try not to make your hook that the person is visually impaired, that's the only reason people should read the articles. There's a term called legally blind, which is one of the most confusing terms out there, because most people who meet the legal definition of blindness actually have usable vision. So I encourage you not to use that term, but if you are going to use that term, please make sure you really understand what that term means and that you speak with the person who you're writing the article about and ask them how best to describe their visual impairment. Focus on ability, not disability. And I think this really goes true across all disability areas. And then present multiple perspectives. It's, just like we don't want to lump all people from a certain country together or all people at a certain socioeconomic level together. We also don't want to lump all people who have a vision loss together. So I encourage you, even if in your story you're only able to quote one person, that you talk to multiple people and get their perspectives so that you broaden your own knowledge base before putting the information forward. And I think it's really important as well when you do a story, whatever that topic is on, that you offer additional information. So for example, if you are doing a story about low vision and you want to help people understand that, as Gary shared, there are tools out there such as eSight 4 that can assist me, that you provide some resources and additional information in your news piece. If you can't fit it into your news piece, please put it on your website. People read or listen to or watch your stories, and they need to know that there's hope out there. But where do I go to get that hope? Where do I go to get that information and resources? So please include that in your media pieces. Well, I only had a short time to visit with you, and I had a lot to share. I hope that you will visit the American Foundation for the Blind website and download our Flatten Inaccessibility and Access and Engagement report. Glad to share this with you. And I want to thank eSight so much for inviting me to be with you today. I'll turn it back over to Lauren.
Great, thank you so much. I think all of you had unique insight to share, and this was a really great presentation from all of you. So we do have a Q&A box if anyone does have specific questions. One question that did come through, it's addressed to Gary, but whoever would like to answer, what are some of the biggest misconceptions about people who are living with vision loss?
Well, I'll happily take that. First of all, and it goes back to that term legally blind, I've had people say to me, you can't be blind, I've seen you do such and such. And then I just have to say, well, yeah, but this is what I can't do. Mm-hmm. And so I can walk down the street without my eSight. I'm not going to bang into anybody, but I'm not going to know who's approaching me. I don't see well enough to make out the features on someone's face. And as a matter of fact, if I'm sitting in the passenger seat of a car and I'll ask my wife, why did you change lanes? And she'll say, because there's a car straight in front of me. And if I turn my head to the right or left, oh, with my peripheral vision, I can tell that there's something there, but I can't focus on it like a normal person would. So I think one of the misconceptions is, what does it really mean to be blind? And for different conditions, it means different things. The bottom line is I can't do what I used to be able to do when I had normal vision, but there's a lot that I can do. But when I put on my eSight, I can do everything like reading and everything like I ever did before. But people often watch me and they'll say, oh, I thought you were blind. Or they'll be with me for an hour and say, I didn't realize you were blind. You had no problem, doing this or that. But it's a matter of what your acuity really is at the end of the day and how much you can do. But people are always confused by that legally blind thing. That's what I present myself as, vision impaired. But sometimes I'll say legally blind, but then I find that I have to go into a long explanation as to what that means in my case and how I get through my day.
Yeah, that definitely all makes sense. And I know the term legally blind is confusing for a lot of people out there. So
Yeah, I would just add from our perspective too, there is a broad spectrum, right? And so all the way from that profoundly blind to, the acuity that's maybe not quite as bad, so to speak. That's why it's so important to develop technology and tools that hit the whole spectrum. Not just one tool is going to work for that full range of people. And I think that's important as developers of technology, that we keep in mind that there is a large group of people that range the spectrum that we're trying to serve, and that we don't get too narrowly focused on one particular group, because they all deserve our ability to help them. And I'll just tell you, just personally, I'm fully sighted, and I would say this, and that I am always amazed at how incredibly adaptive these individuals are. I have never had to learn to live with something that I no longer have. And I would tell you, every day I get to talk to folks, it's very inspiring that people overcome obstacles. And I do truly believe, I believe what I said earlier, in the sense that when we start listening to what they can help us do, as opposed to how we think we can help them, I think we're all going to be a better place.
Yeah. Yes.
yeah, and Dr. Rosenblum, when you were talking about adapting to COVID and the challenges that individuals are facing, the thought came into my mind about voting in this upcoming election and the challenges that will be faced then, and especially with COVID.
Thanks for asking about voting, and it's definitely a topic we are following very carefully at the American Foundation for the Blind and giving our input. So in communities, they do have accessible voting machines. So when you do go to a polling location, you can request that, and there'll be buttons on that you can push that are different shapes. Each locale is different, but let's say a green arrow to advance through the poll, the ballot, and it'll read to you. You have a button that you push to mark your ballot. So there are mechanisms in place. But the challenge, I think, for many people with visual impairments is all the time, but especially during COVID, is I want to do my ballot at home. I want, I don't want to go out because of COVID. I don't have transportation. I haven't had transportation to the polls before, and now especially during COVID, I don't have transportation. And in some communities, there are electronic ballots that you can get, you can fill out, and you can submit. But in some communities, it has to be done with pen and paper. And this is problematic because if I can't access the information on that piece of paper, I'm going to need to get sighted assistance. And then that takes my privacy away. And voting is a very private thing. And we need equitable voting. And so we'll make a big deal between now and November 3rd in the United States, and then it kind of goes in the back burner till we get close to the next election. So I'm really challenging us as a society to not put accessible voting on the back burner until we're a month out from the next election. But instead, let's make this a priority in our next administration, no matter who wins, to ensure that we have accessible voting throughout the country. And this is not just the United States, but all countries.
Right. I definitely think that's very important. Like you said, voting is definitely a private and personal matter. So just making sure that everyone has equal access to that privacy is very important. All right. And then there was a question, do you think products will become more accessible in the future of assistive technologies? But I kind of want to bring that back to how are insurance companies looking at assistive technologies? Are we seeing more and more insurance companies recognizing these tools?
This is Penny Rosenblum, and I can't answer that question specifically, but I can say that it takes people letting insurance companies and healthcare providers and others knowing what they need and what the benefits of those are. So we're not going to make change with any one insurance provider unless that insurance provider hears the many individuals who are visually impaired and those working with individuals with visual impairments to help them understand that no, this is just not a novelty to get this cool eSight thing, but how, as Gary described, the many ways that this device can help me and allow me to maintain my independence. And for insurance carriers, it's about money. So if I have this eSight device, for example, how is that going to save the insurance company money? Well, if I'm using it out in the community, I'm going to be less likely to trip over things. If I'm using it at home to read my medication labels, well, then I'm going to not inadvertently take the wrong medication because I couldn't read the labels. So we have to put it in terms that are understandable to them and affect their bottom line.
Yeah, I would just add to Dr. Rosenblum, you're absolutely right. We've actually begun to have really good conversations with insurance companies that are out there looking to partner with people because this is such a new spectrum or a new area. There are a few supplemental plans that do cover it, but we are also beginning to be bigger advocates. And the more we have conversations around the physician, so that low vision specialist in the optometry setting or that ophthalmologist, they understand how we're trying to advocate, and they're also joining us with that advocacy.
Awesome. Well, if anyone has any last minute questions, feel free to drop those in the box, but I think we covered a lot of ground here. I think there was a lot of unique insights shared. Gary, your story is obviously very inspiring, but do any of our panelists have any last minute thoughts or anything else they'd like to add?
And I'll just end by saying that I really appreciate the opportunity eSight gave me to come speak about people with visual impairments. And I think it's really important, bringing this a little bit back to the media, to ensure that you're not making judgments, and you really do talk to a wide base of people with visual impairments, and that you do go to multiple sources for information to really confirm the facts.
All right. Well, thank you, Dr. Rosenblum, and thank you, Brian and Gary. I think this webinar went amazing, and this year's World Sight Day theme is call to action. So we just wanted to get on here ahead of World Sight Day and spread some knowledge and share some interesting insights. So we hope that you all have a lot to take away from this, and please feel free to reach out if you have any further questions.
Thank you.
Thank you.
Thank you very much.
Bye.